Colts Indiana Jones has been playing with a fractured fibula, with sources reporting he looked good at practice. Let's break down how this might be possible. Daniel Jones is 6'5", 230 pounds. Each leg carries about 115 pounds in normal gait. The fibula bears around 15% of that load on one leg, carrying approximately 17 pounds, while this tibia takes on a remaining 98 pounds. Now, zoom in on this fibula itself. The thin bone on the outside of the lower leg, the proximal and mid-shaft parts of the fibula highlighted are where that 15% load is transmitted. Now look distal, a little bit lower, and this portion below the ankle mortise essentially carries 0% of axial load. Its job is mainly ligament attachment, not weight bearing. Jones is almost certainly dealing with a fracture down here, with the mortise still congruent and the ankle structurally stable. This distal fibular fracture can allow athletes to still walk, cut, and even continue to play once pain is controlled. A higher true weight-bearing fibula fracture, or anything that widens the mortise here or impacts the syndesmosis, would have ruled them out immediately due to the risk of serious complications. Down here, common fracture patterns we worry about are usually an avulsion fracture, where an inversion of that ankle leads to one of these ligaments pulling and ripping off a flake of bone. Number 2, a microfracture, which can be a bone bruise with a tiny cortical crack from direct impact or rotational load. And 3, stress fracture. Though uncommon, these can be played on early if the ankle is stable. And a higher up option is an incomplete non-displaced mechanically stable fibular shaft fracture, but this would be extremely rare. It would have to be a tiny hairline cortical crack with no angulation, no cortical step off, no propagation line, and no involvement of the syndesmosis or ankle and knee stabilizers. Even then, pain and propagation risk make it far less playable than a distal chip or avulsion. Jones's case, we know he already played through the fibula injury week 12 versus the Chiefs, and this had been originally listed following the bye. That strongly favors a non-displaced, stable distal fibular chip or avulsion fracture. These can be played through with a drop in quarterback mobility, increase in pain on lateral shifts in the pocket, decreased power on that drive leg push on throws, decreased slow plant and escape on rollouts, and a slight increased risk of fragment displacement, worsening sprain or tendon irritation, as well as chronic lateral ankle instability that might require surgery in the off-season. And there have been other cases where players have been medically cleared for this. Last time was Cole Beasley a couple years back. Wishing Dimes a safe and speedy recovery.